If you have pain in your lower back and your lower back posture looks like this, I want to show you how you can permanently fix it with the exercises in this video. My name is Dr. Jared, and we call this swayback posture anterior pelvic tilt. And it primarily happens for two reasons. Reason number one is tightness. And most often this happens in your hip flexors. One of your primary hip flexors attaches on your lower back and then comes in and attaches to the front of your femur. When it is tight, it pulls your lower back forward and creates this anterior rotation in your pelvis. When we hold this posture or this position for a long period of time, it can cause some tightness and some crowding here in the muscles and the vertebrae of your lower back, and that's what causes pain. But then that leads us into reason number two why your lower back looks like this, and that is weakness. Your lower abs are held in this stretched position, and then your glutes are also held in a stretched position, which leads to weakness over time. And that causes an inability of those muscles to correct this posture or this position. And so if we want to fix it, what do we need to do? Very simply, we stretch where it's tight and we strengthen where it's weak. And so we need to stretch the hip flexors and the lower back so that we can get out of that anterior tilt position, and then strengthen your lower abs and your glutes so that it holds your back in that better position long term. That's the benefit that I hope that you get from this video. Let's jump in with the first exercise. Let's start by stretching out those tight hip flexors. This is my favorite stretch to do that. You're gonna get down on the ground into this tall kneeling position. I've got my right leg forward, my left knee is down on the ground. That's the hip flexor that I'm going to be stretching out. I want you to keep this really good posture and just lunge forward onto your forward leg. So in my case, I'm gonna lunge forward onto that right leg until I get a really good stretch right here through the front of the left side. If you bend forward, you're not going to feel it as much. If you stay nice and upright, that's going to enhance that stretch in the front. You can then take this a step further by reaching up and over your head slightly with that same hand. So I've got my left knee on the ground. I'm going to lunge forward. I'm going to lift up with my left hand, and then I'm going to lean slightly away from you. And what that does is that just puts that hip flexor muscle, that psoas muscle, on a maximum stretch. I would hold it there for 20 seconds, and then I would repeat that 3 times on both sides. As far as those tight lower back muscles, I've got a couple of different stretch variations that I want to show you for those. The first one, if your knees are painful, if your lower back is super tight, this is kind of an easy way to get into stretch number one. This is going to be a double knee to chest stretch. You're going to lie down on your back. With your hands, you're going to grab both of those knees and pull them into your chest. The most important part on this is I want you to pull far enough that your tailbone clears the ground. So basically, don't think of it as pulling your knees into your chest. Think of it as using your knees to pull your tailbone up towards the ceiling. And when you pull up that high, oh, that's just a really good stretch in through your lower back. I would hold that in a comfortable position for about 20 seconds and then repeat that 3 times. Now, if you can tolerate it, if you're okay kneeling down, the stretch that I actually prefer is going to be the child's pose stretch. This is a common yoga stretch. And what you're going to do is kneel on all fours, hands are in front of you, keep your hands in this position right here, and then just sit down on your heels until we get this good rounding all throughout your entire spine, and especially down there into that lower back. Same parameters on this one. I would recommend that you hold that for 20 seconds and then repeat it 3 times. Now, if you've tried those exercises so far, your lower back is probably feeling better as we've alleviated some of that tension. But now what we want to do is train our muscles to hold our back in that better posture. Again, we're going to focus on the abs and the glutes to do that. Here are my favorite exercises. So go ahead and lie down on your back. The first thing I want to do is teach you what a posterior pelvic tilt posture looks like. If you're in this anterior tilt position, your pelvis is probably forward and your hand can slide underneath your lower back. You've got a lot of space underneath that lower back. What I want you to do is use the muscles in your abs to pull your pelvis backwards, to flatten that arch, to to push your back down into the floor. You'll see I can't get my hand under my back now. And so now what I want you to do is get back into the anterior tilt, so lift your back up off of the ground, and then use your muscles to engage and pull into that posterior tilt position again. And usually what I'll do in the clinic is I'll have someone do about a minute worth of these reps just to kind of get a feel for that, to create that mind to muscle connection as we come out of the anterior tilt, rock our pelvis backwards, flatten our hips, flatten our back into the ground, hold 1, 2, 3, and then come back up to that starting position. So we're going to go from the anterior to the posterior tilt. And then once you've learned that posterior tilt position, that's the one that we want to strengthen in. And so another great exercise to help you to do that is going to be a reverse crunch. And so the first thing I want you to do is get into this posterior tilt position, flatten your back down into the ground, brace your abs, and now what I want you to do is lift both knees up towards the ceiling, but most importantly, I actually want you to clear your tailbone. And so again, I want you to actually point that tailbone up towards the ceiling and then return to the starting position. And so what I want you to focus on is using your abs to pull the top of your pelvis up towards your rib cage or your tailbone up towards the ceiling. That's how we're going to be sure to engage those lower ab muscles. You would repeat that 10 times and then do that for 3 sets. That's my favorite exercise for the abs. The one that I like for the glutes is going to be a glute bridge. Now the first thing I want you to do is, again, find that posterior pelvic tilt position. So flatten that back down into the ground, hold that position, feel that in your abs, and then you're going to engage your glutes to lift your hips up towards the ceiling. Keep in mind that I want you to maintain that posterior tilt position. If we get up here and it's a really big arch, we're just engaging that arch in the lower back again. That's not the position we want to strengthen in. So use those muscles in your abs to pull your pelvis back into this neutral or posterior tilt position. And then if we can do 3 sets of 10 of those, most people can. I like to show people the more advanced version of this would be the single leg bridge. And so now I'm going to extend my left leg, keep my right leg bent, keep that good posterior posture, that posterior tilt position, engage the glutes on that right side to lift my entire pelvis up towards the ceiling, hold for a couple of seconds, and then slowly return right back down to the starting position. Keep in mind, we want to keep that nice flat back throughout that whole motion. 3 sets of 10 on each leg is a great number to shoot for. Now, my goal with every patient that I work with is to progress their exercises into more functional movement patterns. And this last exercise that I have for you is one of my favorite combination exercises. We're actually going to stretch the hip flexors and strengthen the glutes at the same time. This is going to be a glute lunge. What I want you to do is get into as wide of a stagger stance as you can. Right now, I've got my left leg back and I've got my right leg forward. And then I want you to fold forward at your hips, let your chest kind of collapse down towards the floor. From here, we're going to lower down into a lunge, and what you'll feel down here at the bottom of the lunge is a good stretch in the hip flexors, but then also a really good stretch in that opposite glute. So in my right glute, I'm getting a really good stretch. I've got a good stretch through the hip flexors. Now what I want to do is engage that right glute, focus on using that to push myself back into this upright position. So I don't want you to focus on the quad muscle. I don't want you to straighten your knee. I actually want you to extend your hip to get out of that squat or out of that lunge position. So from here, I'm going to stretch through the left. I'm going to fire the right glute to come up to this posture, this position right here, and then slowly lower right back down. And then what you're going to do is you're going to repeat that for 10 repetitions on the right, 10 repetitions on the left, and then repeat that for 3 sets. I hope these help your lower back to look and feel amazing. Thank you so much for watching.